So the coronavirus is named after the is named because of the crown-like spikes that protrude from its surfaces, and it has the virus is enveloped in a bubble of oily lipid molecules, which actually fall apart when they come into contact with soap. And that's why hand washing is so important, because you can actually break up the virus if you make it get into contact with soap. The virus enters the body through the nose, mouth, and eyes, then it attaches itself to the host cell using those spikes. Think of those spikes like a key that allows the virus to enter the host cell. Then it releases its genetic material, which is called the RNA, and gives the host instructions to make copies of the virus. Each infected cell can release about 1 million copies of the virus before the cell finally breaks down and dies, and then new copies of the virus are released from the host cell where they can infect more cells. So basically the virus gets into the host cell and takes it hostage and forces it to make more and more copies of itself. What I wanted us to get really from this is that the virus has an envelope around it that breaks down when it comes into contact with soap. So hand washing, key of that slide. So symptoms, what people present with, and I think everybody knows this: a fever, a high fever, a dry cough, sore throat, runny nose, congestion, decreased smell, decreased taste. Those are the symptoms that most people who get COVID-19 present with. So the symptoms and the spread of COVID-19 are based on two things: how the virus uses our body to reproduce and spread infection, and how our body's immune system and how it responds to the invader. As the cells are damaged by the reproduction of the virus, they release cytokines, which trigger a series of responses called the inflammatory response. So basically, two things determine how we react to COVID: how your immune system is, and then how the virus gets into your body and starts reproducing and spreading the infection. Once it has gotten into your body and it has started producing, your body starts automatically fighting it, and therefore you release these cytokines. Think of them as soldiers that come out to start fighting this inflammation, and that's what is called the inflammatory response. So the inflammatory response, actually your body is trying to fight this virus, but it can increase damage to the cells, which in turn releases more cytokines, creating a vicious cycle that can lead to death. Almost every organ can be affected. So it can affect the heart, it can affect the lungs, it can affect the gut, your GI system, your stomach. It can affect your kidneys, it can affect liver. Today, we're just going to focus on the effects it has on your lungs. So, pulmonary system symptoms. What do you see when it affects your lungs? Decrease in the oxygen, and we usually check that with the pulse ox, and we see anything under 93 on room air when you don't have extra oxygen. When we take your blood work, we can see that you have increased carbon dioxide, increased respiratory rate, you're breathing fast, with a respiration higher than 22, feeling short of breath. Your lung sounds, when we listen to them, we hear wheezing and crackles. When we do a chest x-ray, we see a chest x-ray that shows opacities, which is basically pneumonia. Then you can also have a pulmonary embolism. And then all this, your body is fighting all this, and it sends itself into a systemic inflammatory response syndrome, which is SARS, which leads you to have acute distress symptoms. So at this point, someone needs to be on the ventilator. And the sequela of that is that your organs basically start shutting down. And this is what leads to death. So you can see why someone who already has the pulmonary system compromised, like patients who have COPD or asthma, this can really go very fast. So route of transmission, primary transfer is by respiratory droplets. So when you sneeze, cough, laugh, sing, and it can potentially stay in the air up to 3 hours or land on another surface and be picked up by a new host. So look at this. For example, on aluminum or latex, it can last for about 8 hours. On glasses, it can last for 5 days. So this is the importance of disinfecting. And then most of us have been wearing gloves, and you wear gloves nearly the whole day, where you're touching this and touching that. I've seen people in the store with gloves on, and you're touching different surfaces. And then you go to your car and you're touching your car. It can last on latex for nearly 8 hours. So all those things you've touched, you're transferring. So best thing, again, as I said, hand washing, hand washing, hand washing. Best way to combat this virus. So let's look at a few lung diseases and how people who have those diseases are affected by this virus. So people with underlying health diseases like COPD and asthma or lung cancer are not more likely to contract the virus. However, if they get it, they have worse outcomes. So I know that a lot of people have been thinking, oh, I have asthma, I'm doomed, I'll get COVID. No, you have a chance just like anyone else. However, the fact is, if you get it and you already have asthma, your chances of having a really bad time with this virus is more increased than someone else who did not have an underlying lung disease before. So let's go, we'll do just two of them. We'll do asthma and COPD. So asthma is where your airways become inflamed. There's a lot of mucus and swelling, which makes it hard to breathe. For people with asthma, the recommendations, the CDC recommendation is, one, know your triggers. So one of the triggers could be seasonal allergies. If you know that allergies or exercising really hard triggers your asthma, know that and be aware of that and stick to your treatment regimen. So maintenance, medications, if you need to take them, keep taking them, even if you feel fine, so that you avoid the chances of getting sick. And the trigger part, if you know that allergies is your trigger, take your medications faithfully. If you know exercises is your trigger, take your medications prior to exercising so that you don't trigger an asthma attack. Follow your asthma action plan. Know when to call your doctor. For these people, for asthma people who already have their lungs compromised, sooner than later, you need to call the doctor. So if you have symptoms, now the worst thing is that asthma symptoms really do mimic COVID-19 symptoms, because if you're having an asthmatic attack, you're coughing, you're sneezing, you're having shortness of breath, you're not sure if this is COVID or this is an asthmatic attack. Call your doctor. Don't wait. Exercise can actually help to improve your lung function. So walking, but again, if this is your trigger, take your medication before exercising. Try to minimize stress and anxiety. Those again are triggers for an asthmatic attack. And ways to minimize your stress and anxiety include, taking a walk, meditating, doing breathing exercises, which we will talk about at the end. So with COPD, it's an inflammatory lung disease that obstructs airflow from the lungs. Air tends to get trapped in your lungs, and it's a lot harder for you to blow it out. Recommendations: do not go to stores if possible. Try to have the food and pharmacy items delivered to you if possible. If not, and you have to go out, limit the number of times you go out. So make a list, know that you go at least once a week or even once every 2 weeks if possible. And when you go out, always wear a mask. Watch your weight. Obesity causes mechanical compression of the lungs and chest cavity. And it also increases the work of breathing, which is already impaired because your lungs are impaired. So watching your weight, do not be heavy, because the heavier you are, the harder work you have to do to breathe. Listen to health experts when it comes to guidelines, precautions and testing and social distancing. I know we're all very tired of how long we've had to be doing all this, but for patients who already have their lungs compromised, you need to keep at it. Then practice pursed lip breathing, and I'll talk about that at the very end. Get up, move around. That helps to improve your oxygen absorption. Again, exercise is good for mental health. Most people who have COPD frequently suffer from depression and loneliness. So anything that you can do to make sure that you're taking care of yourself mentally, just so that you're not having an anxiety attack, which can trigger a problem with your breathing. If you start coughing more or feeling like you're struggling more to breathe, call 911. Again, this is a population that we're not saying stay home and take care of yourself. Call 911 because you have an increased risk of dying at home. And as Wamboi said, the chat is open. So as I'm going through this, if you have a question, just type your question at the chat, in the chat box, and then we'll go through that at the end. So pulmonary health. So 2 things determine the health of our lungs. So one is your lung capacity, and that's the amount our lungs can fully expand. And the other one is lung function, and that's how efficient our lungs can process oxygen and distribute it to the rest of the body. Lung capacity is basically what you're born with. So you either have it or you don't. There's nothing much you can do about it. However, lung function is something that you can improve. So let's talk about things that you can do to improve your lung function. So strength training. So actually lifting weights improves your thoracic cage muscles and core strength. And that's very important for breathing, because if you don't have enough strength in your thoracic cage muscles, you're not able to expand and take in a deep breath. Cardiovascular exercises, walking, dancing, jumping rope, things we used to do when we were young, increases the efficiency, the lungs, of how the lungs use oxygen, and also helps to eliminate carbon dioxide. So you jump rope, you run, you walk. Walking is good, especially if you're hurting. That's a good thing to do. Now, if you're not able to do any exercises at all, for the elderly or patients who have physical limitations, deep breathing exercises can help. So this is, again, what I said, giving you practical tips that you can do every day. 3 breaths, as big and deep as possible, every hour, on the hour. It helps to mobilize parts of the lungs that are unused, and it decreases the chances of pneumonia. Pneumonia basically is dead space that you're not using in your lung. And if you make this a practice on the hour, so it's 7 p.m. right now, taking a deep breath and take it out. 3 breaths every hour. That's something you can do. Make it a habit every day, every hour, actually, every hour. Did I take my 3 breaths? Did I take my 3 breaths? That just exercises and makes you use part of your lungs that are sometimes unused. Again, we'll talk about more things that you can do, but keep that in your bank. 3 breaths, as big and deep as possible as you can, every hour. Why do we want to improve lung function? And how can we do that? We've answered why, because you can improve your lung function, you're breathing better, you're using parts of your lungs that you do not normally use, you've decreased your chances of pneumonia. So how can we do this? So I've been talking about pursed lip breathing, and I'll show you what that means. This is pursed lip breathing. So you inhale slowly through your nose, and then you purse your lips like you're about to whistle, and then exhale through your pursed lips. That's pursed lip breathing. That's really crucial for patients, especially who have a lung that is already compromised. However, it's something all of us can do. So when you're practicing, when you're doing your 3 breaths on the hour every hour, you can do it this way. And this helps to control, it helps you to breathe better, get more air into your lungs, and strengthens your lungs, helping your lungs to work more efficiently. So again, inhale slowly through your nose, purse your lips like you're about to whistle, and then exhale while keeping your lips in that same position like you're about to whistle. Other tips, sitting upright. So these are things our parents taught us. Sit up, your body posture. When you slouch, you're closing up your diaphragm, you're decreasing the amount of oxygen that is going all the way into your lungs. So sitting upright increases your peak ventilation and reduces your airway obstruction. I see some people adjusting right now. Sit up, good. And leaning forward with arms bracing a chair or your knees, and the upper body supported has also been shown to improve ventilatory capacity. So like the picture depicted there, if you feel like you're really having a hard time breathing, if you lean forward and put your elbows on your knees, that helps to open up your lungs and helps you to breathe better. Other things you can do, avoid smoking or vaping. Smoking actually causes your lung tissues to be inflamed, making them very fragile and susceptible to infection. And tobacco also harms your immune system and your airway lining that contains the cilia. We all learned that in biology, the little hairs, which are the ones that fight the viruses. That's your first line defense against viruses. So when you remove that, you've actually exposed yourself to infection. Stay up to date with your vaccination. This helps to strengthen your immune system and keeps you and those around you healthy. You know, with vaccination, it's not only about you, it's about the herd being immune. So when you get your vaccinations and you keep up with your vaccination, you're also helping those who are around you to stay healthy. And diet is really important. Exercising, diet, getting enough sleep, it's so important. We compromise on our sleep, and the effects are actually really bad when you do not get enough sleep. Recommended about 8 hours a day, up to 10 for our teenagers who hardly get that. And that compromises your immune system. So exercising, eating well, foods that are high in antioxidants like bananas, apples, tomatoes, grapes. Those are foods that we should be taking in because it increases your immune system. Foods high in vitamin D and omega-3 fatty acids like salmon. That's good. Vitamin D, I don't know if you guys have as big a problem as we have here, because we are indoors so much and we are not getting our vitamin D. So a lot of people here are vitamin D deficient. That's something, make sure that your doctor checks. Because we're assuming you might not be because you're mostly out in the sun, but you just make sure that you have your doctor check. How's your vitamin D level? That's one assignment I'm giving everybody. Make sure your doctor checks that. And if you're low, the best way to go about it is to get it through diet or just outside in the sun. If that's not an option and you're indoors a lot of the time, take a vitamin every day, a vitamin D supplement. However, again, I said the best way to get it is through natural resources. So as we kind of come to the close, let's go through some of the CDC recommendations. So number one, of course, is hand washing. Soap and water for at least 20 seconds. Sing the happy birthday song twice is the best way we've been telling people to remember this. Wash your hands, wash your hands. Hand washing is the best thing you can do to combat this virus. Stay out, avoid touching your eyes, nose, and mouth. Those are things we used to also be taught by our parents. So let's remember that. Don't touch your face. Even if you've washed your hands, just make it a habit to not touch your face. Social distancing is an important part of combating this virus. Stay out of crowded places. Wear a mask if you have to be around people. Cover your cough and sneezes. Again, these are things we were taught by our parents. Common courtesies: cover your cough and sneezes. And once you're done with that, wash your hands, or at least sanitize. And then clean and disinfect frequently touched surfaces. So tables, doorknobs. One time I shared this with my family, and one of my aunties said she never thought of disinfecting her glasses. Again, remember, it can stay on the glasses for up to 5 hours, 5 days, 5 days. So disinfect. Again, you don't have to go crazy. If you feel like you've been outside, you've been exposed to people who are questionable, you can, do your disinfection. If you've been in the house and really no one has come in, you can do your daily cleaning, but you don't have to necessarily go crazy about disinfecting. But the biggest point, if you're sick, stay home and call a healthcare provider, unless you have COPD, asthma, or any other lung disease. At that point, please make sure you call your doctor sooner than later so that we do not find you sadly dead at home, because your lungs are already compromised. You do not want to take a chance. And that's it for me. I'll take any questions.
Thank you, Damaris, for that amazing presentation. I think that's the most detailed discussion we have had about COVID in this forum. And I think it's really useful. I don't have a question. I just want to make a comment about how people back home, at least, are just talking about, do you know somebody who has corona? Do you know somebody who has somebody who knows somebody who has corona? So like there's this notion that we don't know anyone who has corona, so we shouldn't be worried and we shouldn't be venturing out and people are feeling safe. And I'm just wondering what you can speak to us about, even if we are not in proximity of it, how we can just try to protect ourselves.
Thank you. That's a good question, Omboy, because it's not only there. Even here, we have the same thing. Many people are like, fake news. It's fake news. I don't know anyone who has it. I don't know anyone who knows anyone who has it, so it can't be happening. It's real. It's real. I work in a hospital, and sadly, we've had to remove a lot of people from the ventilator after weeks and weeks and weeks, and they've died. So this disease is real. And sadly, a lot of people come in with that notion that, it's not real. until it hits them. When it hits them, it is not pretty. It's good that you don't know anyone who has gotten the coronavirus. So keep it that way. Keep the people around you safe. Keep yourself safe. Better safe than sorry. The other part I wanted to say is you kind of insinuated a little bit. There's a stigma attached to having corona. We are going into the flu season here. Our flu season starts in October up till maybe March next year. All you need to do to get the flu is go outside and someone breathes and you breathe in. That's it. Same thing with COVID. So there's a stigma that even here, where people are hiding the fact that they've had COVID or they've been infected by COVID, and I don't understand it because it's not something that you did. You might be out there wearing your mask, doing everything, but something just happened and you got infected. So I'd advise people to share, talk about it, talk about how you're feeling, because I feel like you might not know people who have it because people are really also not sharing. So they might disappear. A friend of mine just told us a funny story that their brother disappeared for about 10 days, not answering calls, not talking, not calling anyone. And then after 10 days comes back and says, hey, I thought I had COVID. So I had just hidden myself. Even my wife didn't know what was happening. Really, no. Because if you have it, you need to tell your wife so that she knows to take care of herself. So let's remove that stigma. And I think this is really the right forum to talk to, because we talk a lot about stigma with dementia. Again, there's nothing you did to get it. It just happened. So the same thing with COVID. Now, if you are being careless and the things that you needed to do and you're not doing, then you could hide in shame. But let's support each other and let's keep ourselves healthy. It's a good thing that you don't know anyone who has COVID.
So, if you have a question, just use the raise hand function. So Mary has a question. Mary.
Thank you very much for that presentation. It was really good. And I want to ask a question about people with dementia and some of the things to do to help, especially if somebody is not able to go out and do exercise and get the vitamin D, and also indoor, they're not cooperative with doing the exercise and not accepting to eat any fruits or vegetable, and still have carers coming in from outside. So they still that risk and the family going out and about and coming back. What would you advise in keeping the person safe and also to try and prevent them from the pulmonary sort of infection?
Good question. And you've actually talked a lot about why the older people are more at risk, because they're not able to as much. They're not able to possibly eat the diet that they should be eating so that they're able to stay healthy. One thing, as the carers coming into the home and as the family that are going in and out, it's really your responsibility to make sure that you're not bringing anything home. So like for me, I work in a hospital. I come home, my family hasn't been anywhere. They've been on lockdown, they've been at home the whole time. It's on me to be the responsible one. Put away my clothes, wash my hands, wash myself before touching them. So just putting those stop gaps with your carers and with the family members that are in and out for that patient, so that you guys are protecting the patient. Passive exercises are things you can help. So you can do passive exercises for someone who's not able to get up and do exercises. And what's passive exercises? Basically, take an arm, move it up. Take the other arm, move it up. Take the other leg, move it up. You know, things you can do with the patient who's on the bed. For vitamin D, place their bed or their chair or their wheelchair close to somewhere where they can get the sunlight. And that helps. If they're able to take medications and they're not able to take any fruits or anything, ask your doctor if they can get supplements, just so that you're supplementing on top of what else. So little tricks, little things. If you feel like they need more vitamin D, make sure that they're getting the sun. Place their bed, place their wheelchair close to the sun where they can get more of that. Vitamins, talk to the doctor about adding that into their regimen if possible. But the biggest thing for that population is we have to take care of them. So we who are coming into contact with them, we have to be responsible to make sure that the buck stops with us. We're not bringing anything to them. I hope that answered your question, Mary.
Yes. China, Christina has a question.
Okay.
Yes, please. I wanted to ask about the prognosis of people who have asthma when they contract COVID-19. Have you seen, are there success stories? Does it mean that anyone who has asthma is bound to get worse when they get COVID-19, or it depends on other factors, like if their asthma has been well controlled? What really influences the prognosis of that? And then the second, then the second question is, have you, since you work in hospitals, have you seen older people who have pre-existing conditions get well after contracting COVID-19?
Damaris, can't hear you. As Damaris reconnects with us, if you have another question, you can use the chat function, or you can use the raise hand function again.
Hello?
Hello, we can hear you now, yes. Welcome back.
Hello? Hello?
Okay, that's someone else.
Yeah, it's Lisa.
Yes.
You can hear me?
Yes, I can hear you.
Okay. That was a nice presentation, although I missed part of it. My speaker was off.
Yes.
I wanted to ask Doc about the patients who have suffered COVID. Are there those whom you have seen, they have had the reinfection? And how do they fare on after the reinfection?
Yeah.
And also, are there some who go on and get immunity?
Thank you.
Yeah, that's all.
Cool. Thank you, Lisa, for your question. I'm just typing out so that when Damaris is back, I hope she had your question, but she'll first answer Christina's question.
And Wabui, the chat is off. It's disabled, so people are not able to type in.
Sorry. Thank you for reminding me. I've put on the chat function on. I'm sorry. Sorry. I forgot about that. So is Christina? Yes, yes. Damaris has joined. Okay. Hello. Still connecting. Yes. So just waiting for Damaris to get back on the meeting. And she'll answer the questions that have been asked. And I've switched on the chat function. I'm sorry, it was off. I switched it for security purposes. Does anyone have insight on those questions about immunity? But I think Damaris is the best person to answer those questions.
Hello, I'm
Yes.
back.
Yes, yes.
I'm so sorry. Technical difficulties, sorry.
That's okay, we understand.
So can I go ahead and jump into the question about prognosis of asthma? And did anyone who already had prior comorbidities, if they've ever survived? So prognosis of asthma really depends on so many things. I've seen a lot of people who've had, let alone asthma, I've seen people even with lung cancer, which has really compromised their lungs, survive COVID. So there's a host of things. One is how soon you sought medical care. Two, how was your immune system prior to you getting COVID? How well was your asthma control? Is a good point, and yes, that's part of the reason that would help you get through this. However, there's a lot of unknowns also with this disease. There are people who come in who have really no prior comorbidities, so not only even just the older people, and they suffer worse outcomes as opposed to people who had prior comorbidities. So do your part, keep yourself healthy. There's everything, there's a whole spectrum. I've seen patients who are younger, we're talking 40s, who come in and are on the ventilator for months and months and months and don't survive. And then I've seen older ladies coming in, 80. I just had a patient who was 80, who was on the ventilator for a long, long time and went home. So you do your part, and I think the rest we leave to God. But I think sorry, one boy, the biggest takeaway is if you have a chronic disease, it's very important that at this time you take care of it. So anything, blood pressure, diabetes, lung disease, whatever it is, if you have a chronic disease, now more than ever, make sure that your disease is controlled.
There's questions on the chat function. Lisa, when you are away, Lisa asked a question about patients who've suffered COVID. Have they gotten reinfected, and if there's development of immunity? And yeah,
good question. So reinfection, we haven't really seen a lot of that. But the good thing about it, and that's why I wonder even about the stigma. If you get it, you're not able to give us plasma. So plasma is one thing that we've started doing, harvesting from patients who already have gotten COVID and have recovered. And that really helps. That really helps patients. We've seen patients who've been given the plasma treatment and have come off of the vent. So if you have had COVID, please don't hide, because we need your plasma to help other people to get better. I'm looking at the chart. If soap breaks down the virus, would spraying our houses with soap from an aerosol bottle help? I don't know. What I'd say is wash your hands. I don't want us to get too crazy. This is akin to being told to drink bleach because bleach kills the virus. Don't go crazy. Use the soap on your hands and sanitize surfaces that you frequently use. That's all you need to really do. How effective are the lungs when a patient recovers from COVID-19? That is something that has been shown it doesn't recover. So the lungs, if you have COVID-19, especially if you had a really bad strain and it really affected your lungs, that in itself right now is still being researched on how effectively your lungs heal. So far we see on CAT scans and on chest x-ray a lot of scarring, which kind of predisposes you to a lot of lung diseases after that. So unfortunately, that still shows like it doesn't fully recover. So even if you recover from COVID, your lungs really take a beating.
I think that's it for the question. Now, Martha has a question.
What would you advise patients that were in the ICU and recovered? Do you get advice? Do they get advice them on continued nutritional practices? Yes, so definitely, as I said, you've recovered. We don't know the rates of reinfection yet. Just this past week, there was a nurse who worked in my hospital that said she's been reinfected already. Again, that's her telling me. I haven't personally dealt with a patient who's been reinfected. The best way you can take care of yourself is to make sure that you're healthy. So continue with good nutritional practices for sure. You do not want to go back into that ICU. Take your medications as ordered. And the minute you have symptoms, I'd say run back to the doctor, because as I said, your lungs already have scarring. So now you're considered someone who has a predisposed condition. So you need to seek treatment as soon as possible. Is it true garlic would help prevent COVID? I should ask my mother to talk about that. She's in the forum. You know what? All these things have some medicinal value. She sent me a really nice YouTube clip, and maybe I'll share it with the group after this, showing what each fruit, pineapples, garlic, everything, ginger, they all have a component that is needed to keep you healthy. And remember when I said the best way to have this is through natural diet. So instead of popping supplements, try and look for the diet that would help increase your immunity system. So when you have a cold, there's a lot of remedies that you can take to reduce the days that you are sick. It doesn't cure your cold, but it just makes the symptoms maybe less or shorter. So lots of things in the diet are advisable, and I will share that YouTube that I got from my mother so that we can see all the different fruits and vegetables and all the functions that they have in our body. You're welcome, Jennifer. Why is COVID more lethal in some countries more than others? Say Africa has not been catastrophic level as predicted. And Rose, thank you for that question. And I think we all know why, because your country, you were forced to go into a lockdown very early. A lot of us have been very flamboyant. You've seen the news. People are in the beaches, people are working like there's no COVID. We are acting like, you know, we are okay. We are not masking, we're not doing our social distancing. And my husband just said, because Africa also has a younger population. I don't know how true that is. But the truth is, social distancing, keeping your masks, staying away from each other works. So when we were not doing those things, like for example, I work in Pennsylvania. When we were not doing all that, we had an ICU that was full of patients. Now that everybody started doing that, the last time I checked our census, we had 3 patients in the whole hospital that had COVID-19. We are already anticipating that those numbers will go back up when we all get out. So I think the practices that you guys implemented, and you implemented them early, has really helped to keep your levels down. Is there any relationship between cold weather and COVID-19? It's a good question, because one of the early predictors that when COVID started, they were thinking for us during our spring, coming from winter into spring, we'll see cases, and then they were predicting that in the summer period, we won't see as many cases, and they're expecting a rise again as we go into winter. So right now, studies, or rather, the people doing the studies are predicting that there is a correlation, that sometimes during the summer months, hotter months, we are not seeing as high people, as higher rate of infection. And then as we go into the colder months, they're thinking there'll be a correlation with an increase in infections. It hasn't been proven yet. And again, that could be maybe the answer also to Androse's question, that maybe Africa, you guys have very hot weather there. Maybe it's also not too compatible. However, when this whole thing started, everybody thought that Black people don't get it. Africa, they thought it will never get to you guys, and we've seen that that's not true. So all we can do is do our part. Again, the one thing I can say about COVID, and I think a lot of people have not said, is that they really don't know. We don't know. Every day we think we know, and we say, this is the treatment, this is what we should be doing tomorrow. Someone else comes out and says, no, that doesn't work. So we'll evolve as it happens, but there's a few things that are sure, and we can keep doing that to keep ourselves and our families safe.
Thank you. I would just like to also add on your answer about why Africa is not affected by COVID as much, is that unlike other parts of the world, we are not as mobile. We don't travel as much as people in Europe do across countries. So that increased the rate of transmission. So if you look at flight radar, the number of flights in Europe and in the US and in Asia, there's so many flights. And the ones coming into Africa, there are not as many. So there are not as many cases going around as they were in other places. So that might be in lack, and we are not as urbanized. So people live in villages. We think we are very urbanized, but we are not. So we're not concentrated in small places. People live in rural areas, which is a blessing if you think about it for us.
That's true. That's true. That's such a good point, because even us here, people who are less urbanized and have, one home is here and the other one is way further, you've seen the virus does not, there's less infections in such areas as opposed to people who live like in the city where the infection is really high. That's true. And remember, your first case also came from other countries. It did not actually originate from you guys. So you're right, travel does affect that. Good point.
So in many cases, we're blessed in Kenya and very lucky, and in Africa, and it's not about our genes or anything. Anyone can get COVID, but because of how we live. And I also just want to add that we have a sense of community, that in the beginning, you'll see that the mama mbogas brought out the hand washing things without anyone having to pay for it. So people looked out for each other from the beginning. And I think that's the thing that we should continue doing in our small communities. So I just want to thank you, Damaris, for giving us such a wonderful presentation. And yeah, I think we have answered all the questions. And if you have any more questions, you can just talk to Elizabeth if you have her contact. And thank you so much. And
thank you for having me. Thank you so much. I see a lot of the participants, and I am grateful to have had the chance to talk to you guys, and let's keep going. Let's keep doing this. And thank you so much, Adok, for the work that you do in Kenya. Yes. God bless you.
Thank you. Elizabeth, any last comments? No? I'm just going to end the meeting if Elizabeth doesn't have a comment, and I think there'll be a recording of this meeting later, and I wish you all the best and see you in 2 weeks. Elizabeth.
Hi, I just want to say thank you very much. Thank you, Dr. Damaris. and the whole team for joining. I appreciate. Thank you. Thank you. We have been learning a lot in this fortnightly meeting. And have a great afternoon and evening for everybody, wherever you are, and enjoy your evening and day. Thank you.
Bye, guys.